This lesson is on our healthcare careers and looking at both education and different levels of careers that we have in healthcare, the credentials that you need to work in healthcare, and then how we can categorize all of the different careers into 5 different groups. So there are hundreds of careers in healthcare, and they all have different educational requirements. So if you are not the person who wants to spend 8+ years in school getting a doctoral physician degree, there are plenty of options. So an associate's degree is typically a 2-year degree that's at a community college or a career and technical school. Bachelor's degrees are typically your 4-year degrees at your college or university. And then also at colleges and universities, after a bachelor's degree, you can continue on to get a master's degree, which is another 1 to 2 years, or a doctoral degree, which is usually a separate doctoral school for physicians or for pharmacy or for physical therapy or whatever it is that you're specializing in. And that's usually 2 to up to 6 to 10 years, depending on what you choose to special in. So when we look at healthcare careers, we kind of have these 4 levels of careers in terms of kind of who is at the top of the food chain in terms of the most education and the most responsibility also in healthcare. So your aides and your assistants, things like dental assistants, medical assistants, nursing assistants, usually only have to go through some sort of class or certification program, or they receive on-the-job training. And so this is usually a great place to start out, especially if you're gaining experience to try to move on to one of these higher levels. Technicians also can get some on the job training, but usually that's more of an associate's degree. So things like a dental lab tech or a surgical technician can do a minimum amount of schooling. Physician assistants, PAs, also are just an associate's degree. So that's a great option. Technologists or therapists, like a radiologic technician, somebody who does your x rays, is usually getting a bachelor's degree or maybe adding on a master's degree after that. And then you can get a career kind of straight out of college. And then your professional degrees, those are your doctors, your dentists, your pharmacists, your therapists who are getting that doctoral degree. This says bachelor's degree or higher, but really it's that doctoral degree. So after you get an education, you always have to get some sort of credential that says you have the skills and are competent to provide good healthcare. You're not going to hurt anybody. So part of that is graduating from some sort of program that's accredited. And then once you have your credential, you also have to get to continue taking classes and making sure that you're up to date with the most recent like procedures and ways of doing things. And that usually continues on every couple years. So the first type of credential that you can get is a certification. And a certification is granted by a professional but private organization that says you have met a certain amount of qualifications. And so this is like your dental assistants, maybe a lab tech, a medical assistant, the person in the doctor's office before the doctor, or a nursing assistant. A license or a licensure is granted by the state, so it's a government credential. And the state says that you have a specific scope of practice, a certain amount of procedures that you are allowed to do. And so this is usually your nurses, your doctors, your dentists, anybody like that. There's also a credential called being registered. And usually, if you're registered, you still either have a certification or a license, but you are also put on what's called a national registry, which is a list of people who have been certified or licensed in a specific area and have certain skills. And so careers that have a registry are typically like nurses. You become a registered nurse, but you also have a nursing license. Things like a registered dietitian, or you can have medical assistants that are registered with the medical assistant registry. So after you get your credential, you can, or not after, when you pick a career, there are kind of 5 options. And so the first career cluster are those that we typically think of with healthcare. So these are all of the careers that are actually directly working with the patient and trying to change their health. And so this could include your physical careers, dealing with physical health like dentistry, emergency medicine, could include your EMTs, your paramedics, dentistry. You could include the actual dentist or a dental hygienist, dental assistant. Medical is going to be all of your doctors, any sort of specialty, orthopedics, bones, joints, cardiology, heart. neurology, brain, all of those sorts of things fall under medical. Mental health are psychiatrists who have doctoral degrees and can prescribe medications, or psychologists and counselors who are more therapy based. Social services is a really great group that focuses on more holistic care and kind of tries to pull all types of providers in together to make sure a patient is getting all of the care that they need. Mortuary is your care for deceased individuals. So that could be forensics on the criminal side, doing autopsies, or it could just be working in a funeral home and preparing bodies for funerals or celebrations of life, whatever it is. Any type of nursing, nutrition, dietetics. This also includes animal medicine, so veterinary, vet techs. Optometry is our vision, or there's a ton of different types of therapy like speech therapy, physical therapy, occupational therapy. They all deal with kind of quality of life in different ways, whether that's your physical mobility or your occupational therapy is dealing with kind of just general quality of life and how you go about, putting on your shoes or going to the bathroom or anything like that. Diagnostic services is the second career cluster, and this is weirdly not people who diagnose patients. So this is not our doctors. These are people who are collecting information about a patient and then giving that information to the people who can diagnose patients. So if you work in diagnostic services, your license or your certification does not include diagnosing people in your scope of practice. And so oftentimes you'll see people like an ultrasound tech who, if you think of like the person who takes the ultrasound of a baby, they're not allowed to tell the patient anything that they see until the doctor comes in. So these are really just people who are taking samples or information or pictures of patients. So it could be EKG technicians, which is heart. EEG is your brain waves. Ultrasound you can do over like almost the whole body. CT, X-ray, and MRI technicians all take different types of imaging. We have nuclear radiologists who inject nuclear dyes and then can pick that up on the CT, X-ray, or MRI. Medical lab or clinical lab technologists are people who look at blood samples or urine samples or any type of tissue samples. And our phlebotomists are those people who draw your blood or take body samples from people. Health informatics is all of the careers that involve information related to healthcare. And so that could be on the administrator, health insurance, medical coding. So every procedure that you have done has a specific code that goes with it so that health insurance can pay for that. It could include your health educators, people who are teaching nurses, who are in the public health world teaching the general public. It could include admissions, but it could also include people who illustrate medical textbooks, or medical librarians, or photographers, or epidemiologists who collect data about the public. So there's a lot of different places in health informatics. Support services is all of the careers that I like to say kind of help run a facility. And so this could be your kind of front office staff, your administrators, your admissions folks. It could be biomedical engineers, architects, people who design the layouts of buildings, or even the people who design packaging and supply of different medical equipment or different prescriptions or tests, medical tests, like the COVID test. There's people who had to design all of that packaging and the serum and the little thing that you stick up your nose, and all those sorts of things are people who work in support services. It includes people like medical interpreters or translators who help translate from different languages. It could include your housekeeping staff, transportation, whether that's people who are pushing people around the hospital in wheelchairs or actually busing people from place to place. Sterile service technicians are folks who their entire job is focused on sterilizing and cleaning medical equipment and making sure that that's ready to go for surgeons and people who are doing the procedures. So these are critical careers that kind of live in the background. And then the last category is biotechnology research and development. So this is the kind of sciencey side of healthcare. Maybe you're more quiet and you like to work behind the scenes. You don't want to work with patients as much, but you want to work on developing new diagnostic tests or treatments or medications or vaccines, or working on food products, or biomedical engineering to work on robotics and different prosthetics, anything like that. So careers include any type of research, genetic research, anything like that that's helping to improve human healthcare. Forensic scientists, geneticists, pharmacologists are people who develop drugs. And toxicologists look at chemicals and safety of different things. So there's a ton of different careers in this career cluster as well.